as you guys know, we're gonna talk about the knee protocol. It's a very basic one, and most of these that you'll find on the PRS really are. You'll find a lot of this on the website already, and you just go under there, and I'll kind of show you that in the, after I talk about this a little bit. But the basic setup here is, the black on the inside, red on the outside. Now, many of you who have worked with the PRS will probably discover that you've done other things that work as well. But this is a nice, just easy one. We call it the sandwich technique, where you're getting those contractions. It gets blood flow into that area. And as Matt said, this, contracts your muscles at 245 times per second, but also has that blood flow feature. So it's a lot like the RX. The difference is this is considered sort of the little son or daughter of what the RX can do. It doesn't mean it lacks abilities to do a lot of amazing things, though. And we're going to go into that with Adam, which I'm pretty excited about, where he was able to go through the treatments and he used the PRS for a lot of different things that he's going to talk about. Now, those of you who already have a PRS, we have started to set up a pretty good library on the website. So when you go into ARPneuro.com, you go down to how the patient side, and then how to use ARPneuro PRS. When you click on that, there, as you can see, it's from ankle all the way down to hand and wrist. Almost in the center there, you see the knee. And when you click on that, it'll drop down. It gives you the basic picture that I showed you in the beginning. But also, if you click on that, there's a video that takes, every video there is about 2 to 2.5 minutes, just essentially showing you where to place the pads and the benefits of doing so. Now, one of the major comparisons that the PRS does, as well as the RX, I mentioned before, is that blood flow feature. So not only are you getting the contractions, but being able to get that blood flow, it gives you the ability to sleep at night where it's lubricating that area, and you're getting that healing process for the duration of your sleep. So when you're waking up, you're actually feeling better, and that recovery time is a lot faster. Matt was talking about a lot of the pro athletes. We have one in particular that you can find on YouTube as well, where Brandon Marshall, who played professional football, he used this to essentially just surround his knees and run blood flow the entire night while he slept. And he just swears by that, basically saving a lot of years on his joints. He said it probably added 10 years to his career. So something like this, imagine, regardless of where you're at, if you're a weekend warrior, like Matt said, or you're just going through and you want to get out of pain, there's that feature as well. But it's very portable, and it has a lot of different versatile attributes. This one in particular, Matt talked about the workout side. I can't introduce Adam without talking about that, because this is going to be a big portion of what he used it for after he did get healthy. He used the PRS, and he kind of turned into sort of a workout guru from that. And this is just going to be some brief pictures of Adam. I'm guessing this is after his ACL injury, and now he's getting into the movements. And you'll see from this point, a lot of what he did was body weight moves. We'll have to talk about it when we talk to Adam. I don't think he used a lot of heavy weight, mostly just the PRS. I know he took a lot of this to the gym as well and worked out that way. Now, here's going back to where Adam is at. As you see in 2018, that was the before picture. 2023, there he is, at this point, definitely did some progress, and I can't wait to kind of introduce him now. So Adam, you're on the stage now. Thank you for your time, your patience on this. And do me a favor, kind of introduce yourself, your story. I'm going to stop sharing here so the people can take a look at you. And let us know about your injury first on the ACL. What brought you to the ARPneuro Therapy?
So I was originally going in to see Brian and Sam just for chiropractic. This was in 2017, going into 2018. On the job site, all of a sudden I did something, and something did not feel right, because the next day I walked into their office with my knee looking like a grapefruit. Did a little bit of treatment. Sam had me go for an MRI. And in between the MRI and my next visit, my dad actually took me to a friend of his, did acupuncture and did some cupping on it, make a little adjustment. Walked in the next day, Sam saw my x-rays and saw the MRI, and within 24 hours put me on the RX. And you can't really talk about one without talking with using the other. The RX, jumping on that within a week, I had that thing turned up to 100, working through the injury. After a week, yeah, the pain was gone, but the swelling was still there, which one of the two things I could deal with. Until we got back from vacation trip to Australia, which was a 24-hour trip, flight there and back each way, that the PRS was introduced, and I wish I had that on that flight. Just trying to get up and stretch on that was a huge pain, but made it work. As soon as I got back, jumped on the PRS, and it was great to do a session in the office and then come home that night and just put it on and just relax with it. And then just going through the motions, taking it to work with me. I wore it to work a few times, sitting in the Jeep driving. It tells you not to use it while driving. Well, it tells you not to use it, but not cranked up to max as you're driving. I would put it on blood flow just to have that sensation. Even while we were working, I would still have it on background. That helped so much. And then probably within the next year, that's when I met Jake, and he walked in and I see this mountain of a beast, and he's just like, I have you up to 100 on the RX now, and we're having a conversation here. Yes, we are. Started training with Jake a little bit, told him what I'm doing with the PRS. Started working out with it at home, doing body weight movement, tons and tons of body weight movement, isometrics. Oh my God. The one thing that also helped change too was the fact that I was not a big proponent of drinking water. I have a little bit here, a little bit there. This will help you in your water intake tremendously, no matter what. Since 2018, 2019, I'm doing close to, if not over, a gallon of water a day, even using this, if not using it, which was a huge boost to my diet. And like I said before, lifestyle. The PRS and the RX, ARPwave by itself, it is a lifestyle. No matter which way, if you're on it for 6 months, you're on it for a year, it's a lifestyle that I know right now I couldn't live without it.
Yeah, we certainly know you drink the Kool-Aid at this point because so long. Let me ask you a question, Adam. Let's go back to your ACL injury.
Yeah.
You give a kind of a duration of what that treatment was like, time frame wise, and when you finally got out of pain and you felt like you were getting to that normal state again.
It probably took a good, with just the treatment, it probably took me about a good 2 months, because at that time, at the same time, I was still that picture in 2018. So I was overweight. So that was a huge factor of it too. So it was a good 2 to 3 months just with the treatments. But it progressed even quicker once I got on the PRS.
And can you explain that when you say progressed even quicker? Because you sort of alluded to some of that. You like the sensation. Describe that a little bit on that progression after the RX treatments.
So, let's take an average, you go into the office for a session for 30, 40 minutes, an hour, you might not come back for 2-3 days, but between those 2 or 3 days, or even that same day, just putting it right on to keep that sensation and blood flow going. And right at that point, the other part of that for me as well, I had a very bad varicose vein in the same area where my injury was, which also led to a lot of pain and discomfort. But it was nice on days I could not get in. I throw that PRS and I'd wear it all day, not full power, but I would wear it all day until the battery went out, charge it overnight, do the same thing, to where that constant blood flow, that constant movement in that sensation slowly but surely helped me heal. And in between doing the PRS, going for another session on the big guy, which, your body remembers and your body can recover from stuff, but learning to use both and then really using the PRS, it's hard to explain, but yeah, I can't live without either one of them. I just can't. And
Adam,
just
Adam, I've got a question for you.
Shoot.
You know, when you went through that and you got the MRI, were you considering surgery, or was anybody talking about?
Oh, absolutely. I mean, even before the MRI, the first thing that went through my mind, even when it happened, I was in such a panic that I knew there's like, how am I going to recover from this? What if I have to go for a surgery? I'm going to be out of work for a couple of weeks to a few months, then recovery. On the bright side, the injury kind of happened as a blessing, really, because if I did not know Sam or Brian, I never would have found this, the ARPwave technology, to totally avoid surgery. Even now, people are like, well, did you even if you did the cortisone shot, I know from other people that cortisone shot only does so much, and you're going to compensate. I've never touched a cortisone shot, never touched surgery on my knees. It was the PRS, the workout, the water. Jake, everybody that had coaching me for 2 years, working in that office, COVID was a big part of it, which every day Jake is on the TV. I was with Jake at 6 a.m. working every day. And there were days I was doing 2 a days with the PRS.
Okay.
And once it got better with the leads, got better with the pads, you could do 4 pads instead of 2. I was popping 4 pads on one leg for a half hour at a time after a workout.
Speaking of pads, I've got a question, Jake, that if you can answer, comes from one of the participants. If you're treating one knee and have the splitter with access to 4 pads, can you hook up one knee with just two leads and leave the other 2 not being hooked up?
You certainly could. And the way you would do it is you would just anchor the other 2 pads on that plastic backing. You don't have to use all 4. What I would recommend, though, is if if you're not getting enough intensity, to use all 4 of them on the same knee. That's perfectly okay too.
I'm not sure who asked the question, but I don't know if anybody's if Adam was maxing that thing up, and he's a whole different animal because.
Oh, I was maxing it out probably within maybe a week or so of Jake of Jake doing the workouts. I was maxing it out, and at the same time, him and I was working out. I mean, I'd send him, a text or via chat as we were working out, like, dude, I'm maxed out already. Where are you at here?
And those of you who do not know Adam's personality, he talks about getting it up to the max. That's Adam's probably a 1% of the amount of people that do, whether you're on the RX or the PRS. It's that, and it does have that intensity where it is hard to max this out, but for good reason. But that intensity, regardless of where you're at in those numbers, very similar results, like Adam's. So I just wanted to make sure that's clear. We don't have to get to the very top part of this to see the results.
Yeah, as a matter of fact, I'd like to mention that article on the professional lineman, Lane Johnson. He was talking about just before the Super Bowl. He said to his personal trainer, "Okay, let's get this up to 38," and he was bragging about getting it to 38. So Adam, you're tougher and stronger than a lineman in the NFL. Let me just
and you know what? Like even now, being hooked up to the RX, I was helping Jake in the PRS at home. I'm cranking the PRS, and I'm looking at it. I'm like, how did I manage to get this maxed out? And I think to myself, like, oh, well, I was going through some stuff and a lot of in some personal stuff. That's how I dealt with it. Like now, I know I can just go halfway with it, and I can get a decent workout in half hour, 40 minutes, take it to the gym. I'll be in the gym for 2 hours working with the PRS, not even cranking it up, just to get that blood flow and just to get that sensation, but I'll lower my weight. Yeah. And once I'm done doing that, doing actual weighted exercise, I'll crank it up for a little bit, just sit there and just relax with the PR. It's hard to say or funny to say, sitting there relaxed with the PRS after workout at max. Nice. It's just one of those things.
That's good stories. Jake, I have a question from one of the participants.
Sure.
Has a friend with a herniated disc and is thinking of surgery. Could the ARPneuro treatment help him? Should he go? One of the things we like to say is if you're at a level of 6 and above pain level, we highly suggest that you go to one of the clinics to get started. Very similar to what Adam did. If you're on that verge of 6 below, you can absolutely get, relief and support through the PRS. So it's a combination thereof. It sounded like Adam would have loved to have both to start. But if you can answer that, Jake, for one of our participants, that would be great.
Yeah, absolutely. And whoever reached out and answered it or asked that question, thank you for that. First off, we've seen a lot of patients come in with very similar herniated disc or things of the like. And there are benefits. My response is, what can it hurt? If you're looking at the surgery side, at least give it a shot. Anything that where you can get muscles firing up, get the nerves going again. If there's dormant muscles that you can kind of get those fired up again and possibly rebalance where some of those compensations are at, you're certainly going to see some benefit. And if it can keep you from surgery, it's certainly worth a shot. And when I say that, it comes from confidence of the success that we've had with other patients with herniated discs. What I would do is I would recommend, if you are at, like what Matt said, if you're at a pain level of 6 or higher, look at where your location is at to see if one of our ARPneuro clinics are around you. And if it is, I would try to encourage you to try out a session just to see where some of that's at.
Jake, I have another question from another participant that asked, they've got a painful knee. It doesn't hurt. It's not above 6. How many sessions should they typically, will it take, or how long will it take before they kind of get pain free and start building more muscles? Can you describe that a little bit?
Sure. So the pain itself, that's going to be relative. It's going to be dependent on patient by patient cases, but it can potentially get you out of pain day one, or at least reduce that pain day one. If it's not reducing the pain, you're certainly going to fire up muscles and start to increase that range of motion. What I usually say is in the first few sessions or the first few days, if you're using the PRS, it's going to activate things. So in many cases, what it's going to do for you is start to wake things up, where your brain will probably say, I'm actually going through more pain, but that's just the process. Within the first couple of weeks, if you are consistent, it not only pulls you out of that pain, but because you're firing and contracting those muscles, you're fixing those areas that basically had that breakdown where that pain was caused in the beginning. So that was a 2-part question. So to go back to the strength aspect, you can talk to Adam on this one. The strength is immediate. I mean, it not only contracts your muscles at 245 times a second, but it does it at a cellular level where you're getting a muscular breakdown like you would a hypertrophy workout. So essentially you are going to still experience a delayed onset muscle soreness. You're going to experience the same benefits of strengthening muscles. The beauty of this device, and obviously I drink the Kool-Aid, I have for the last 5 years when it was introduced to me, because of that ability to be able to get all that contraction and strength without putting weight on your joints. The older I get, the more important that is to me. And it's certainly important if you're in athletics, if you want to maintain and be a weekend warrior, if you want to play whatever sport it is you do, that's where you want all that impact. You don't want to add weight if you don't have to, or at least a lot of weight. And this is able to keep you off of that. So,
and then two, just because that with that knee injury that this person has, if it's the left or the right, don't be afraid to put it on both at the same time. Treat both legs, treat both knees.
Yeah, and we often recommend that. And I saw that was Bob. So Bob, thank you for that question about the 2 knees. One of the reasons we do recommend you treat both sides, we do things bilaterally. There's a couple of reasons. Just like a workout, you wouldn't work out just one leg. And at the same time, if you're doing a movement, which is where this device really excels, is that you have the ability to go through a movement. It's a lot easier for you to recognize where your compensations are at. If you have just one side firing up at that intensity, the other leg is not going to really be able to distinguish where the true compensations are at. Another indication we do get when both sides are being treated is a lot of times the area that took the trauma is usually the one that isn't contracting as well. So you start to think that your good side is the one that hurts because that's where all the intensity is at. But that is only because there's some dormant areas, perhaps muscles not firing on time, that's why you're not feeling it as well. So it's good to have both of those kind of spread out where you can see that and get those kind of that feedback area of where your body's at.
Okay, great. I got another question here that came through. If somebody is considering a knee replacement, and I've got a ton of friends that are in that because they're on bone, can this help? And if they do go through the knee replacement, can it help recover? So it's a two-part question.
Yeah, whoever asked this, thank you so much. First of all, knees, shoulders, any joints that we're looking at, I always try to encourage people, go in for the first session and see how you feel with it, because we've had a lot of success with bone on bone. And we've had a lot of success with those patients that they were considering knee replacement that absolutely never had to do it because of the ability to contract the muscle. Now you're actually using that muscle as force like it should, and it's taking pressure off of the joints. What was that second part, Matt?
Well, so if you were considering knee replacement, I think that's a good answer. So you explain a little bit more, just because it is mind-boggling. You've got bone on bone, that there's pain there. Can
Right.
you explain how the PRS is building the muscles around to absorb that?
Sure.
To take the pain away, because it's.
Yep. So your muscles are a shock absorber, so to speak. So when they're not firing properly, or if there's some sort of compensation, and you're maybe even a reduction in cartilage, and the muscles aren't really working the way they should, that's where a lot of that pain is going to take place. If you can surround that area and strengthen the muscles around that joint, it's going to help open that up, because now they're strong enough to start to absorb. So the pain is going to naturally go away, specifically because now your muscles are acting as a shock absorber like they should have in the beginning. And in many cases, what we've discovered, certainly on the treatment side, but even with the PRS, is that you think you're strong until there's some other breakdown that you never would have known about until you went through this technology, because it has that ability to pull out some of that breakdown area that just wasn't firing. And so the pain is just sort of the symptom. We say this all the time. There's something else that we're able to find the actual cause, the root of the cause of what has led down to that. And even when it comes to bone on bone, strengthening around there is certainly going to help open that up and strengthen your knees.
So to add to that, I was born bow-legged, and for the first year and a half, I had to wear braces after I learned to walk. So I had braces for a year and a half, and I've had knee pain my entire life. But with the PRS and strengthening both knees, I could actually, before the PRS, I could tell you what the weather was going to be outside, because my knees would be in so much pain. They would just randomly pop. It would be very painful. I've probably now gone almost 2.5, 3 years with absolutely no painful popping, no weather gauge whatsoever. And my legs feel in better shape now at 43 than I did when I was 22.
Excellent. So I have another question here for you, Jake.
Yeah.
It sounds like, and I'd love to hear the comparison for the participants. Everybody knows physical therapy. Unfortunately, probably everybody's gone through just the traditional bands where they're trying to get things strengthened, right? So if you come out of surgery or you have an injury, they typically want an X-ray, then MRI, and then they try the PT with just traditional bands. Could you just explain to the participants and people on, how does this differ so much to that traditional strengthening with a band, if you will?
Absolutely. And let me just preface everything before I even get into it by saying this isn't a dig to what physical therapy and the craft of physical therapist does, because I believe as physical therapists, they are fantastic when it comes to using this device. We have physical therapists that use this device with the craft and with a lot of the movements that they do, with their patients already. The problem with physical therapy is that there's not usually enough time. Insurance won't give them enough sessions, or they have a few, so they end up getting a personal trainer, and they never were fully repaired because they didn't have that opportunity to go through physical therapy as long as they should have. And that's because they do have to go for a long period of time in physical therapy with many of these ailments. With our technology, it's essentially physical therapy on steroids, for lack of a better term. It gives it just a different type of injection of energy because of that contraction speed. So when you're talking on the treatment side at 500 times or even 245 times per second, you're getting that much faster of a contraction than what your brain can do at 2 times per second. But I'm going to sound like a broken record by saying this, but not everyone's going to know where this is coming from. This is that major difference that Matt, when he alluded to the TENS unit compared to the PRS, that alternating versus direct current wave. You have the ability to go through movements, just like physical therapy. But not only are you doing this movement, your brain is now neurologically starting to refire muscles that weren't working correctly. However, no longer at 2 times per second. Even though your body is doing that movement, you have that device that's also assisting those contractions at 245 times per second or 500 times per second. So look at it this way. You're doing this with physical therapy. You're unwinding all those kinks. And in order to get everything back in order, you have to kind of rewire everything and smooth it out. You're doing the same thing, but in this case, that unwinding and rewiring is a fraction of the time that physical therapy would take.
So obviously, when you saw that, when the participants saw that video with Chase Young, was that his name? Right?
Yes.
Yeah.
That's exactly what he's doing. Then he is physically. They showed him working out with the ARPneuro, RX, and that's exactly. It's just firing and regenerating that. Can you go and elaborate that a little bit more?
100%. And I appreciate you bringing up that video because that's the first thing I thought of, right when you asked the question. He was doing movements and he was doing athletic extreme movements. But if you look closely in that video, he had the wires on. So he is also getting those contractions on top of those movements. So in his case, and even in an elite athlete, just even an infinitesimal amount of gains is going to be probably the difference between winning and losing. Or being a champion and coming in last place. They all recognize this. And so they'll take any edge possible to get to that next level, which is why, the ARP therapy is done so well, because it gets them back into their sport a fraction of the time and a lot stronger because now they've repaired that area as opposed to just kind of treating that pain area. The same is true for the weekend warrior. Not that they're necessarily facing those competitive levels of athleticism, but people still have to work. They still want to do their recreation. They still want to live life. They still want to have fun, myself included. You know what? Then why not take that next level where you can go through a movement and actually improve that workout or that therapy a little bit better by getting that assistance.
Well, and you shouldn't have to sit at home in pain after doing something, working outside. If you have this device and you're outside working, doing something, whatever it is, you come home, you're going to be in pain. You're going to want to take a couple ibuprofen, throw the PRS on, sit there with it. Just it'll help you just recover just for the next day, even within 24 hours, instead of having to wait to go for a session or go see somebody.
Yeah, this is interesting because Jake, I just saw a video on our website and I forget her name, but she's a professional bodybuilder and it makes a lot of sense because she was talking about utilizing this, strengthening the muscle without a whole ton of weight to help her joints. And it's now kind of all making sense to me on how, even these professional athletes. And then now it makes sense watching my son go through his treatments where he was, just walking around the office was like doing a 1 hour workout. So it's kind of starting to make sense on how the neurological aspect of the PRS and the RX are kind of firing at that contraction, just as if you're working out for 6 hours. So that makes a lot of sense. And now it makes sense why all the professional athletes, but you guys are too young when you start talking about. Wait till you get to the weekend warrior age and you tell them that they can't play pickle or they've got to get surgery or they can't play golf. You don't, that's probably more important than, a Chase Young trying to get on a field.
Right.
I've seen it firsthand and I've experienced it in the short time I've been with ARPneuro. The excitement of a weekend warrior, my age or older, that's able to continue pain-free with what they love, whether it's golf, pickle, and other recreation. So I think it's great.